Uterine fibroids are non-cancerous growths that develop in or around the uterus womb. They are very common in women of reproductive age and are also called leiomyomas or myoma. Although they are tumors, they are benign, meaning they do not spread to other parts of the body like cancer. Some women may have only one fibroid, while others may develop multiple fibroids of different sizes. In many cases, fibroids are small and do not cause noticeable symptoms, but in other women they can grow large enough to cause discomfort and various health problems. What the uterus is? The uterus is a muscular organ located in the female pelvis. It is the place where a baby grows during pregnancy. The wall of the uterus is mainly made of smooth muscle cells, and fibroids usually develop from these muscle cells. How uterine fibroids develop? Fibroids begin when one muscle cell in the uterus starts to grow and divide more than normal. Over time, this abnormal growth forms a firm mass made of muscle and fibrous tissue. Doctors are not completely sure what triggers the first abnormal cell change, but several factors are known to influence the development and growth of fibroids. 1. Hormonal influence. The female hormones, estrogen and progesterone, play a major role in fibroid growth. These hormones are produced by the ovaries and are responsible for regulating the menstrual cycle and preparing the uterus for pregnancy. Fibroids tend to grow during the reproductive years when hormone levels are high. Estrogen and progesterone stimulate the uterine muscle cells, and fibroids have more receptors for these hormones than normal uterine tissue. Because of this, fibroid cells respond strongly to hormonal stimulation and continue to grow. This is why fibroids often shrink after menopause when hormone levels decline. 2. Genetic changes. Research has shown that some fibroids develop due to changes in the genes of uterine muscle cells. These genetic alterations cause the cells to multiply faster than normal cells. Women who have a family history of fibroids are more likely to develop them, suggesting that genetics may increase the risk. 3. Growth factors in the body. Substances in the body called growth factors help control cell division and tissue repair. When these growth factors become overactive in the uterus, they can stimulate excessive growth of muscle tissue, leading to fibroid formation. 4. Extracellular matrix buildup. Fibroids contain a large amount of fibrous material, known as the extracellular matrix. This material surrounds the cells and makes fibroids firm and rubbery. The buildup of this fibrous tissue contributes to the gradual enlargement of the fibroid. 5. Blood supply to the uterus. Fibroids also develop their own network of blood vessels. This blood supply provides oxygen and nutrients, allowing the fibroid to continue growing over time. Types of uterine fibroids. Fibroids can grow in different parts of the uterus, and their location determines their classification. Intramural fibroids. These develop within the muscular wall of the uterus. They are the most common type and may cause enlargement of the uterus if they grow large. Submucosal fibroids. These grow just beneath the inner lining of the uterus and may extend into the uterine cavity. They are often associated with heavy menstrual bleeding and fertility problems. Subserosal fibroids. These form on the outer surface of the uterus and may grow outward into the pelvic cavity. Large subserosal fibroids can press on nearby organs, such as the bladder or intestines. Pedunculated fibroids. Some fibroids grow on a thin stalk attached to the uterus, either inside or outside the uterine wall. Symptoms of uterine fibroids. Many women with fibroids experience no symptoms. However, when symptoms occur, they may include heavy or prolonged menstrual bleeding, pelvic pain or pressure, frequent urination due to pressure on the bladder, constipation if the fibroid presses on the intestines, lower back pain, pain during sexual intercourse, difficulty becoming pregnant. In some cases, large fibroids may also cause the abdomen to appear swollen or enlarged. Risk factors for developing fibroids. Certain factors increase the likelihood of fibroid development, including being in the reproductive age group, family history of fibroids, early onset of menstruation, hormonal imbalance, obesity, diets high in red meat and low in fruits and vegetables. What happens to fibroids? Over time, fibroids grow at different rates. Some remain small for years, while others enlarge rapidly. Their growth often depends on hormonal activity. During pregnancy, fibroids may grow because hormone levels rise. After menopause, many fibroids shrink due to reduced hormone production, although fibroids are usually harmless. Very large ones may cause complications such as severe bleeding, anemia, or pressure on nearby organs. Suprauterine fibroids are benign growths that originate from the muscle tissue of the uterus. They develop when uterine muscle cells grow uncontrollably under the influence of hormones, genetic factors, and growth signals within the body. Fibroids can appear in different parts of the uterus and vary widely in size and number. While some women may not notice any symptoms, others may experience heavy bleeding, pelvic pressure, or reproductive difficulties. Understanding how fibroids develop helps healthcare providers determine the most appropriate methods of monitoring or treating them.